Good morning again, and welcome to the new year and the beginning of a new series of JRG's webinars. I'm Frances Horn. I'm the presenter for today, and I am the Employee Benefits Compliance Officer for JRG. Just some housekeeping. I want to let you know that the presentation will be sent to you, and that any questions we receive will also send you those questions and answers, and you'll also receive a recording of the webinar. As a reminder, if you have any questions, if you can go ahead and type them in and then send them to us, we'll again address them at the end of the presentation. So with that, let's go ahead and get started. Also, we want to go ahead and thank all of our partner members who invite, their members to come and participate. We hope that you're enjoying these series of webinars. So let's just briefly look at our agenda. Now the topic today is really about Medicare secondary payer. As I said, I coined it, should they stay or should they go? So I want to make you aware, we're not talking about the Medicare benefit programs and what you need to be able to participate. We're talking about when we have individuals who may be Medicare eligible and how we have to handle them as to our group health plans. So we're really more concerned about an employer's obligations to its employees who are Medicare eligible. So briefly, we're going to talk about a definition, group health plans, who's going to pay first, Medicare or the group health plan, some special rules and some exceptions to the special rules, and then we're going to talk about some takeaways, and hopefully you'll have some questions. So let's go ahead and start with, and we know that Medicare was created by Congress back in 1965, and it's a health insurance program, and it's really broken down into three parts. Part A covers inpatient hospital stays, home health care. So again, we're looking like at hospitalization type issues. Part B is medical insurance. It will pay for doctor's visits, preventive services, diagnostic tests. And then we have Part D, and we know that that covers the prescription drug coverage. Now, Medicare is administered by the Center for Medicare Services. It's actually Center for Medicare and Medicaid Services, but the Social Security Administration is responsible for enrollment. Now, everyone always thinks that once you reach 65, you're automatically enrolled in Medicare. And that's really a fallacy, because the only way you're automatically enrolled once you reach 65 is if you have elected to receive Social Security benefits early, or if you are receiving some type of benefits because of a disability, then you are automatically enrolled in Part A. However, if you're not receiving any Social Security benefit, then you actually have to affirmatively enroll. You'll get a card about 3 months before enrollment that you turn 65, and then you have to go ahead and send it back. Otherwise, you're not enrolled in Part A. Now, as to Medicare secondary payer, and we use MSP as the shortcut for that, it's the term generally used when the Medicare program does not have primary payment responsibility. So that's when another entity, like an employer's group health plan, has responsibility for paying benefit claims before Medicare. It's analogous to what we know under our group health plans as the coordination of benefits. It's the requirement that Medicare is a secondary payer to any plans that would be primary. And when the Medicare secondary payer rules were enacted by Congress, it literally was a cost-shifting mechanism. They wanted to go ahead and say, let's move some of the cost again from the government onto individuals and onto employers. So on the next slide, we want to know that as a primary payer that we mentioned on the previous slide, it's a payer who's responsible, again, for first payment of a claim. And generally with the Medicare secondary payer provisions, it applies to two broad categories of insurance. We have group health plans and non-group health plans. Now, non-group health plans, we're not going to be going into this today, but I just want to go ahead and briefly mention it to you. They're basically considered liability insurance types issues or workers' compensation. These types of programs are always, again, primary to Medicare. So liability insurance might be like, or no-fault insurance would be like a car insurance, or a property and casualty type thing. If somebody falls and gets hurt on somebody's property. As to the group health plan, it's health coverage sponsored by an employer for a group of employees generally. And when we say group health plan, I just want to throw a reminder out there that if we have what's called a health reimbursement arrangement, that is a self-insured group health plan. So unless it is a HRA that's for a very small employer, meaning less than 20 employees, that the Medicare secondary payer rules are also subject, or HRAs are also subject to the Medicare secondary payer rules. And we're going to talk a little bit about a reporting requirement that could possibly exist out there for HRAs. So on the next slide, again, just want to go ahead and touch base about group health plans. We know that the primary payer, they have to provide the same coverage to Medicare beneficiaries as they do for all other individuals. A carrier is required to process and make primary payments on a claim. And if the group health plan does not pay in full for the service, then Medicare, as a secondary payer, can go ahead and will go ahead and pay, and it's up to an approved amount. And again, remember, we're only talking about those who are eligible for Medicare. It's not for anybody under the plan. And then likewise, if a service is not covered by the group health plan, but Medicare says that it's covered under Medicare, they'll go ahead and pay for it first then. Now, when certain conditions are met, Medicare is a secondary payer to group health plans for services provided to the following groups of Medicare beneficiaries. The first group is known as aged Medicare beneficiaries, or also they're considered the working aged, disabled Medicare beneficiaries, and those who are eligible for Medicare based on end-stage renal disease. So the first thing that we're looking at for aged Medicare beneficiaries, we're looking to see that the employer employs at least 20 employees. We're going to talk a little bit more about that on the next slide, but that's the first thing that you have to remember. If you're going to be concerned about the Medicare secondary payer rules, you would be an employer who is 20 or more, and again for aged-based, 20 or more employees. And the plan is going to cover beneficiaries who, again, are at least age 65. They're insured by the group health plan, or the spouse is insured by the group health plan. And coverage is based on what we consider a current employment status. So current employment means basically they're actively at work. They're coming to work every day, or you're paying them to show up. Or it's also if somebody is associated with an employer in a business relationship. However, there's another instance also when you can be considered actively at work. Even though you can be considered actively, but even though you're not active, if you're in a situation, if the employee is on short-term or long-term disability or some type of sick leave plan from the employer, and they've retained their employment rights. So basically that means they've never been terminated from the employer. They've been kept on the active roll and they keep their rights. They may still be accruing vacation, they may be still accruing seniority, those types of things. And then they also have employment-based group health plan coverage that is not COBRA. So it means that they haven't terminated an elected COBRA, but they're still there. So let's talk for just 1 second here about this 20 employee threshold. And why do you think maybe Congress picked this number? Did they just pull it out of their hat? And really they didn't. They did have some kind of reasoning behind it. And it's basically because the Medicare secondary payer rules are based on the premise under the Age Discrimination in Employment Act, the ADEA. We know that the ADEA says that an employer cannot discriminate as to the terms and conditions of employment against someone based on their age. So this is where we get the premise under the MSP, and we get the threshold of that 20 employers. So we're saying when someone is 65 or older, for Medicare purposes, you can't discriminate against them because of that age. Now, we know that under the ADEA that the age discrimination, it's a much lower threshold than 65, but for purposes of Medicare, that's the number that we look at. So going to the next slide, let's talk a little bit about that 20 employee test. Now, a lot of employers will get confused because I'll be talking to them that and they'll say, well, I don't have 20 full-time employees, or I don't have 20 employees covered under the group health plan. The threshold is it's 20 or more employees for each working day in each of the 20 or more calendar weeks in the current calendar year or preceding calendar year. Now the key is that next bullet. It means 20 employees, whether they're full-time or whether they're part-time. And this is not the same like we do with the Affordable Care Act. We're not equating full-time employees. It's literally a count of 20 employees. We also know that self-employed individuals, when they're covered under our group health plan, that they're not counted. So if the company that you work for is a subchapter S and the shareholders, the more than 2% shareholders are in the plan, those are considered self-employed. They wouldn't be counted for that 20 threshold. It's the same thing with a partnership. Partners are considered self-employed. And the key thing is those 20 weeks, they don't have to be consecutive. So maybe in January, you may have 2 weeks that you have 20 or more employees. You fall off a little bit for the next 2 weeks. And then in February, 3 weeks you have 20 or more. You fall off for a couple weeks. So again, you have to be careful and you have to watch after these 20 weeks because they don't have to be consecutive. And basically, if you would get audited to say as to, okay, did you have 20 employees or more, what you're going to be looked at are your employment records, basically your payroll records. Who is on the payroll? So if someone is on your payroll, then they're going to be considered an employee. The other thing that we also have to consider, again, we've been talking a lot about common control groups because of the Affordable Care Act situation, but now even also with Medicare aged and to see what size the group is, we look at common control. So if someone has 2 companies and one company has 8 employees and another one has 12, each employer would be looked at to say that they have 20 employees and would be subject to the Medicare secondary payer rules. Another note, or not a word of caution, maybe so, that as soon as an employer meets that 20 employees for the 20 weeks, the group health plan becomes primary in that year. So it's not like, oh geez, I'm only meeting the 20 employee threshold in October, so I can go ahead and start following the Medicare secondary payer rules next January. No, if you become have 20 employees as of October, you have to start complying basically immediately. On the next slide, we're going to talk a little bit about reemployed retirees. You know, in our current economy, it's not uncommon for someone to retire from one company and then go and work for another company, or even retire and come back to that same company. We just know that, again, the way that our society, that we're and with our economy, that we just have a lot of situations like that. So we just want to give you a reminder that if you are reemploying older people, and even if they are on Medicare already, if they meet the terms of eligibility of the group health plan, then you can't deny them coverage. You have to go ahead and offer them coverage just like any other active employee. So they're considered covered, they would be considered covered by reason of current employment status. And again, that's even if they're receiving the same group health plan coverage under a retiree program, and even if their premiums are being paid from some type of retirement plan. So continuing talking about age-based Medicare beneficiaries, when administering the group health plan, the plan, meaning the insurance carrier or the employer if you're self-insured, and also the employer to a certain degree if you're fully insured, you cannot take into account the fact that an actively working individual or his or her spouse is entitled to Medicare. So what actions do the rules consider as taking into account? It's things like if you're offering coverage that pays after Medicare. You may not pay a provider of a service a lesser amount because someone's Medicare eligible. You can't impose limitations on benefits or apply a higher deductible or coinsurance amount. You can't charge a higher premium for their coverage. You also can't require them to wait longer, and you can't terminate their coverage or deny coverage, again, because they're Medicare eligible. Another key thing is a lot of employers have been taking steps to say, you know, we have these Medicare eligible people. We want to bring someone in and have them talk to Medicare. You have to be very careful because you cannot provide any type of misleading or incomplete information that could induce a Medicare eligible beneficiary to reject the group health plan coverage and, again, drop it and just go on to Medicare. Continuing with these prohibitions as to aged base. An employer of an actively working Medicare beneficiary or spouse, again, you cannot refuse to cover, offer different coverage, nor restrict the type of coverage that they have. If an employer offers any types of incentives to, you know, encourage or make the group health plan, make them decline the group health plan and then go on to Medicare, a civil penalty of $5,000 can be imposed. You know, some people may step back and say, geez, $5,000, that's not very much. One thing that the statute and the regulations are not really clear on, they don't say if that penalty would be imposed on a monthly basis, on a per occurrence basis, per individual. It's really vague about this, again, the civil penalty. And we're going to talk a little bit more about some other penalties that come about when Medicare has paid incorrectly. So also, we want to go ahead and make you aware, someone who is Medicare eligible or either is already on Medicare or thinking about it, they are free to reject or decline your coverage. They can waive it if they want to. There is no problem with that. The key is that it has to be voluntary. You can't provide them any type of inducement or initiative or incentive to go ahead and drop that coverage and then to go on your plan. And one thing that CMS has made clear is that if an employee who is Medicare aged eligible does drop your group health plan, you cannot pay for any type of Medigap policy for that employer. And you also cannot pay for any type of Medicare supplemental plan for that Medicare beneficiary. So you want to be very careful that, you know, if an employee would come to you and say, you know, I'm thinking about waiving the coverage, and you say, hey, that's a great idea. I'll go ahead and pay your Medicare supplement if you do that. You would be subject to offering an incentive or inducing them to waive your coverage. So again, you just want to go ahead and be aware of that. On the next slide, let's talk about this, and I call this a minor exception to offering an incentive. We know that the Department of Health and Human Services, considered HHS, they're actually the enforcement arm for CMS, and they have informally stated, and again, they have not put this in a regulation. It definitely is not in the statute. But anytime that there has been, that someone has tried to bring a claim of a violation, it has not been upheld. The HHS has said this is an acceptable practice. And what this acceptable practice or minor exception is that if an employer provides a cash opt-out through a cafeteria plan for employees to receive a cash benefit when they waive the employer's group health plan, then those who are Medicare eligible can be included in that cash opt-out. The guidelines that have to be followed, and again, HHS is very clear on this. First of all, there has to be a valid Section 125 or cafeteria plan in place. An employer cannot just start doing cash opt-outs. Under the cafeteria plan rules, it says that your cafeteria plan has to be in writing. You have to have a document that outlines all these terms, which would include the cash opt-out. The other requirement is This cash opt-out, cash opt-out has to be available to all employees. You can't just say, geez, if you're on Medicare, you can get the cash opt-out when you go on Medicare. So the terms of the plan really have to say, if you waive our group health plan, we'll give anybody who has other coverage $100 a month or $50 a month, whatever you decide is reasonable or within the budget. So again, it has to be through a cafeteria plan, and it has to be available to all employees. Another word of caution, you have to watch how you word this cash opt-out. Because I've seen employers who do this, and they'll say, we'll give you cash if you waive our coverage because you have other group health plan coverage. And that can be a catch because Medicare is not other group health plan coverage. So that would eliminate someone who's Medicare eligible from getting the cash opt-out. So if you're thinking about this, the way you would want to have your cafeteria plan worded is if you opt out because of other coverage. So that other coverage could mean individual coverage, maybe you're covered under a spouse's plan, or maybe you have another employer that you work for that you have other group health plan coverage. So I want to make you aware that how important the wording is in your cafeteria plan when you have a cash opt-out when it comes to Medicare eligible employees. So on the next slide, we want to go ahead and now just talk about when Medicare, when the group health plan pays first in other situations. And the next area is disabled beneficiaries. So when an employer has at least 100 employees, you see the threshold has moved up a lot. And if you have someone who has been disabled, they're basically disabled by Social Security, but they're not able to receive Medicare yet, the group health plan would be primary to, or even if they are covered under Medicare, but the group health plan would be primary to Medicare, but it's only if you have at least 100 employees. So if you only have the 20, you have to worry about age-based Medicare, but not concerned about the disabled beneficiaries. Again, the requirement, they're under age 65, entitled to Medicare, and that's due to a disability. And they're covered under the plan because of their own employment or current employment or a spouse's current employment. And then finally, the next group we're talking about, and this is where an individual may have end-stage renal disease. The requirements are that a group health plan must cover for the first 30 months when an individual or an employee has end-stage renal disease. And this is regardless of the employer size. So again, we talked 20 employees, age-based Medicare. We talked 100 for disability. There is no employee requirement for end-stage renal disease. So even if you only have a plan with 3 employees, you would be subject to the health plan paying first in this situation. And again, the taking into account rules apply. The same thing, you can't say, geez, you have end-stage renal disease, you have to pay a higher premium, we're not going to pay the provider as much, you've got a longer waiting period. And on this slide, I try to put a little cheat sheet together for you. I think hopefully you enjoy having little takeaways from these webinars where you can either put them on your desk or put them somewhere and say, hey, you know, we talked about this and I need that reminder. So this little cheat sheet, it just really walks through, talks about if you're eligible, what kind of coverage you have, if you're Medicare eligible based on age, disability, end-stage renal disease, or if you're a retiree. And then it tells about the conditions as to when Medicare will pay first or the group health plan will pay first. So we're at the slide already that we want to talk about some takeaways. And before we get to those, there are several issues that I didn't mention, but I just want to go ahead and briefly talk about. And I said, remember we talked about the $5,000 civil penalty, and I said, geez, the penalties can be a little bit even stiffer than that. Now, if the Center for Medicare Services sees that Medicare has paid primary instead of a group health plan, then CMS can take actions and collect that payment from an insurance carrier. And if the insurance carrier doesn't pay, they can also take action against an employer. And you really want to be careful in these situations because CMS can not only collect the actual damages that they would have, meaning if they paid $20,000 and they shouldn't have, they can collect $20,000, but the regulations give them the right to collect what's called treble damages, 3 times what the actual damage. So I gave the example of $20,000, so CMS has the right, instead of collecting $20,000, they can collect $60,000 from you. Now, I don't want to use this as a scare tactic, but you know, that only, I have seen it happen, but it only happens if, you know, maybe you'll get a questionnaire and you don't respond to it. Or they're saying, well, can you talk to your carrier about this claim because our records show, geez, this person was working for you at that time, and you put them off and you put them off and put them off. So again, it's basically, if you're reasonable and work with them, generally you probably won't receive, you know, extra damages. But it's for, again, I've seen where an employer has just kind of like said, you know what, this problem is going to go away, I'm not going to deal with it. And that's where there's more problems can arise. And then also I briefly mentioned when we were talking about the reminder that a health reimbursement arrangement is a group health plan. It's a self-insured group health plan. And under this arrangement, for group health plans, there is the requirement to report coverage that is available to CMS so they can always review to see whether Medicare should be paying primary or secondary. So when we talk about health reimbursement arrangements as group health plans, this information has to be reported to CMS, but it only has to be reported when the benefit is at least $5,000. So if you give a benefit of $5,000 or more to an HRA at the beginning of the year, then that benefit is available the entire year, and that's when you would have to start reporting that it is available. However, if you give the HRA maybe like money in increments, say, oh, we'll give $200, or no, we'll say $500 a month. You'd only reach that $5,000 benefit later on in the year versus meeting it the first of the year. As to this reporting to CMS, the way that the rule reads, it says that an insurance carrier or a TPA is a third-party administrator, is responsible for reporting this information to CMS. But it also says if you have a self-insured plan where the employer self-administers the benefit, then the employer would be subject to the actual reporting. So again, just wanted to make you aware of that. So let's get to our takeaways here. Verify your number of employees as to the application of the MSP rules. Again, remember, it's every employee. It doesn't mean full-time or full-time covered under the plan. Review your plan documents to ensure that the plan complies with the MSP primary payer requirements. Make sure that you don't take into account, don't put a plan into place where, you know, you're saying, well, gee, since you're Medicare eligible, yeah, you can come on our plan, but you have to pay $50 more a month. Or, you know, maybe the benefits won't be as good. You know, just, you can't take any of that into account. Ensure that the benefits are the same, you know. If we have 2 different plans, we can't say, well, we're going to offer the lesser plan if you're Medicare eligible and the better plan if you're not Medicare eligible. So again, not taking into account any Medicare eligibility. And then finally, ensure that the employer, as the plan sponsor, plan administrator, that you're not offering any type of initiatives or incentives for employees not to enroll, or that you're terminating them from the plan, from the group health plan, or again, if they voluntarily waive the coverage, if you're not giving a cash opt-out, if they voluntarily waive that you're not, again, either paying any type of supplemental coverage for them or paying for their Medicare. So with that, we went through that rather quickly today within our half-hour time frame. We'll go ahead and open it up and see if we have any questions. And as of right now, we don't have any questions.
We do have a question, Francis. It doesn't appear that the HRA caveats regarding 5K/CMS reporting you mentioned are included in the slides. Will you provide written info on them?
Okay, yeah, and I'll be honest with you. It was an afterthought this morning as I was looking through my presentation. Yeah, I can't provide information on that. I can provide that to you. When we answer the questions, and actually, I've talked to someone just last week about this, and I sent an email, so I have that, and I can send it out. And that's under, it's called the MMSEA. It's Medicare and Medicaid. Oh, yeah. I forget the rest of it, but I'll get you that information. Thanks for asking for it.
If anyone has a question, please type it in the questions box and hit send, and we will answer your questions.
Okay, well, it doesn't look like we have any other questions coming in, so I want to go ahead and take the opportunity to thank you for participating today. I hope you found this, informational at least. I always have the tendency to say, I hope you enjoyed it, but we don't always enjoy these types of webinars. And as a reminder, we're going to go ahead and mention that our next webinar is going to be on February 11th. And it's going to be talking about cafeteria plans and which menu is right for you as to your cafeteria plan. So with that being said, we'll go ahead and end the webinar for today. And again, thanks so much for participating.